Hello, this is Dr. Gautam Banga. I am a reconstructive urologist and andrologist working in Delhi NCR for last 10 years. Today I want to discuss the topic of erectile dysfunction, which is quite prevalent in male population. Initially it was considered as a problem or a disease or a issue in the later age of life, maybe in the age of 60 to 70. But during my practice I have come across many patients in the age group of 20s, 30s and 40s coming with erectile dysfunction. With the changing lifestyle and the other environmental factors, the erectile dysfunction is quite prevalent and it's increasing in incidence. The major cause of erectile dysfunction are diabetes, hypertension, type A personalities, and various drugs which a patient or a person consumes. And trauma is also one of the causes in which the patient can have erectile dysfunction. So when a patient comes to me with the complaint of not able to achieve a good erection and not able to have a normal sexual activity, then we take a detailed history to know what can be the contributing factors in the particular patient. We do a complete examination, and if required we do certain investigation which include hormone studies, blood investigation, and if required color Doppler to know the blood flow in the penis. And erectile dysfunction can be treated in various ways. So the first line of treatment is always counseling, behavior therapy, as well as we give medication as a supplement or as a main line of treatment. And these medicines are basically to increase the blood flow to the penis. They act locally, they are very safe, and in a young patient it doesn't have any side effect in the form of any effect on the heart or any other organ. In old age, the only contraindication for these kind of medicine are in old age patient or cardiac patient who have poor cardiac reserve, or they are taking nitrates. These drugs are very effective, and most of the patient, say around 60 to 70% of patient coming with erection problem respond to this kind of medication, and they can take that for longer period of time. Then if the patient is not happy with the results of medication, oral tablets, or they are not getting the desired result, they are not happy with the side effects, they have mild side effects which are there. So if they're not happy with that, then we go on with the second line of treatment, which includes vacuum pump and shockwave therapy. Then the third option is intracavernosal injection. The vacuum pumps are easily available, and we teach the patient how to use the vacuum pump, and then they can use it. Vacuum pump have some inherent side effects, which is in the form of cold erection. The penis become cold, and sometimes the sensation decline with the use of vacuum pump and the ring. Shockwave is again a new modality of treatment which we are using, and it has very limited indication, but in those indication it has given very good results. So the patient with mild vascular problem, that in which the blood flow is partially declined to the penis, or the patient with mild diabetes mellitus who sometime or often on respond to the tablet. In this patient, shockwave therapy 4 to 5 session, and we can also combine it with the PRP, that is platelet rich plasma. It gives very good result, and the success rate is in the range of around 70 to 80%. And sometimes we have to repeat it after 2 years, but that is more like a booster dose for the vascular increase in the vascular flow. The third treatment option is intracavernosal injection. That is the injection which we can give directly into the penis, and it is as and when required kind of treatment, that whenever the patient wants to have an erection, he can use the injection, put it directly into the penis. It's a self injection, and they can achieve an erection. Side effects are there in the form of pain or formation of the plaque or fibrosis. And it is the modality which the patient can use for 2 or 3 years, but after a certain time the effect declines or the fibrosis is significant, and then we have to move on with the third line of treatment, which is the gold standard for erectile problem and give the best satisfaction rate, and is one of the safest modality of treatment. that is penile prosthesis or penile implants. There was a lot of doubts related to penile implant, that the erection is not similar to a normal erection. The sensation goes down, the penile length decreases, and the orgasm is not there. So these are all myths, and I am here to clarify that the sensation remain the same, the orgasm remain the same, and the patient partner satisfaction rate is very high, and they feel the same kind of sensation which they feel with a normal erection. So penile prosthesis is a very effective mode of treatment, and now we are doing around 5 to 10 inflatable implant, and in total around 15 implants a month with very good results. There are various types of implant which are available, and they range from semi-rigid 2-piece inflatable to 3-piece inflatable. Semi-rigid implant is a simple rod which is placed inside the penis, and in most of the time the penile length remain static. The only thing which you can do is you can bend the penis down when you are not doing any sexual activity, and then you can wear your trousers, and you can do normal activity without penis showing out of your clothes. And whenever there is a need of sexual activity, you have to just lift the implant or the penis, and the penis is rigid enough to do the sexual activity. The advantage is cheap compared to inflatable implant, and easy to place and easy to use, and most commonly the patient who are old age and who cannot actually coordinate the pump are very much benefited with this implant, especially in patient. And the other category is the patient, if the patient is illiterate and cannot learn how to use the pump, then also we can place this kind of implant, and they can have this sexual activity in a normal way. Coming to the second implant, which is a 2-piece implant, in which there are 2 cylinders which are placed in the penis through a surgery, and it has a pump. So this pump is placed close to the testis inside the scrotum. So once the cylinders are placed, when the penile implant is inside, after the 6 weeks, that much time is required for the post-operative healing and for the implant to make up space for itself. The patient has to press the pump 4 to 5 times. So the fluid which is there in the pump goes to the cylinder, and the cylinder becomes rigid or hard, and the penis get erected, and the patient can do sexual activity. Once the sexual act is over, the patient have to just bend the penis to 90 degree for 10 to 15 seconds, and it becomes soft, and it can be easily the penis can have a normal shape after the sexual activity. Now coming to the third type of implant, which is you can say the best implant available at the moment, is a 3-piece implant, in which there is one pump, then the 2 cylinders, very much similar to the Ambicor implant, which is a 2-piece implant, and then it has a reservoir. The benefit of reservoir is that it provides the cylinder the best hardness which can be achieved with the implant, and the pump has 2 components. It has a pump as well as a button to deflate it. So when the patient wants to do a sexual activity, he has to press this pump 5 to 7 times, and the cylinder will become hard, and the patient can have a sexual activity. Once the sexual act is over, he just have to press this button once, and he has to squeeze the cylinder or squeeze the penis, and all of the fluid will come back to the reservoir, and the penis will become flaccid and totally concealable. So these are the various implants which are available, and I just want to inform you that this is the best method if you are suffering, and if any patient or any friend of you is suffering from erectile dysfunction, not responding to medicine or not responding to other modalities like vacuum pump, please suggest them that the penile implant is safe. It can be done easily. It's a very safe surgery. Results are very good, and the patient can have a sexual activity, normal sexual life for next 15 to 20 years. Thank you.